So let's come back around to POS again. So you started this, in 1984, is I think the year we started it. Did you have any idea what the ride would take you on?
No, no. My vision was this far, and it just went to the whole world, and it just kept expanding, partially because of me, though, because I just kept trying to find a better way, and realizing that the dentists that I was teaching, that were looking to me to teach them in the right way, just like a patient would look to me, that I was obligated to come up with something that they could understand, something they could do, even though they'd been told they couldn't. And so in the process, it went way beyond just making out some title slides and teaching a few concepts and helping somebody with a diagnosis. Went way beyond that. It came into, well, wait a minute, let's make it so that you don't have to make wire bends. Let's make it so that they're not going to have this problem that only the most skilled people could get through.
I think that's been kind of a hallmarker of your philosophy with POS, is that it has to be 100% reproducible by every dentist in the world. And you've traveled the world, you've taught dentists in every country in the world, basically. There is a POS guy in almost every country that I've ever seen, with tremendous amount of different backgrounds and different training. But you teach a single system, whether they're in Beverly Hills or Timbuktu, and your belief has always been, if you teach a certain way, no matter who you are, no matter what your background is, you can still perform orthodontics at the highest level in the entire world.
That's exactly the objective of a seminar that has 50 people in it. They're all not at the same skill level. And the teacher is probably the most skilled in the room, or should be. And I had great hands. It was easy for me, okay? But can you expect everyone in the room to be able to reproduce what the most skilled person is doing? No, it's impossible. So you have to get down to the basic level of, well, what can everybody do here? And everybody can put a bracket on the tooth, and everybody can probably choose the right bracket for that tooth with a little bit of training. And through different bracket designs, they can do phenomenal work that only previously the most skilled orthodontists could do.
And I think looking at your career and how it's developed with IP and everything like that, I think that being forced to make it so reproducible has also made you a significantly better orthodontist. Because I remember you telling me one time with, all those wire bends, well, you could do all the fancy wire bends. You'd go back and relook at your cases afterwards and you'd say, well, this case didn't come out as good as that case. And you'd be like, well, why'd that happen to me? And, well, I just had a bad day of wire bending, because some days your hands just weren't working as well as other days. And I remember you kind of saying, well, if I can make it reproducible for every single dentist in the world, why can't I reproduce every case to be at the highest standards? And so taking away a lot of the hand skill that is variable between one dentist to the other.
And the same dentist day to day.
And the same dentist day to day allowed you to increase the level of orthodontics significantly, because of every case is going to come out super good, because I'm taking away those variables.
If you, at the beginning of a case, can promise somebody that they're going to look good through this and their money's going to be well spent, right? And their effort's going to be well spent, and having to clean their teeth with brackets on it for the next 2 years is going to be worth it.
Yep.
Okay, then you definitely want to be able to come through with that promise.
Right.
And if you can do that on a consistent basis and meet and exceed the expectations of that patient, your practice is going to boom.
And that was the entire kind of motivation between IP, was get away from wire bending. Make it so that every single person could place a bracket, which is something that you felt like is much more reproducible. And if they just made the right decisions, put the bracket on the right spot, let the tool cook, the quality of care would go significantly up.
And it did.
And it did.
It did. There's just no question about it. Things that only I could do through elaborate, experienced wire bending with a tremendous amount of effort in the office. Oh my gosh, all I did all day long was bend these wires, trying to make the cases turn out. And of course, most dentists, orthodontists, even if they can do it, they aren't going to do it. It's just too much effort. It's just too much. It has to come from inside you.
Right.
And if you don't have that personal desire to exceed and to do a great job, the patient is going, take them off. I'm happy. They're straight. And you're going, no, they aren't. I'm not done yet. I've got more things I want to do. And my biggest problem was talking them into more and more and more, so that I could personally be satisfied with the job that I did. Now, IP, through the bracket designs, the arch wires, the different shapes of arch wires, the different materials in the arch wires, all of a sudden, I didn't have to wire bend. I didn't have to wire bend, and the cases looked like I spent months and months and months of wire bending on them. I just saved
Hours
of tedious work.
Right.
Okay? And now all the other students that learned how to use that could come up with those results without having to go through the wire bending and have the exceptional skills that it took to make that happen. All of a sudden, we had like a system that you could get the best results without being the best at wire bending and even treatment planning, because I wrote the treatment plans.
Where do you see ortho going?
In the specialty or
As a whole.
As a whole.
I don't like to separate out the specialty from the generalist, because in my opinion, if the general dentist is doing the same quality work, ortho's ortho. So where do you see the field going?
Well, people are always going to want to have straight teeth. They're going to want to look better. I think that's a given. I don't think that is going to go away. I think that'll only get more. So ortho is something that the demand for care will increase.
Right.
Orthodontists have been reduced in numbers every year for the last 20 years, I think. And they're not putting out enough orthodontists to take care of the ones that are retiring or died or whatever. So it's reducing number, which means that the ones that are there will be probably quite busy, and that's fine with me. Be busy. I think there's an opportunity in orthodontics with the increase in demands, and if you're educated to see the work that needs to be done, there's a tremendous opportunity for you in an area of dentistry that's very rewarding. It's very rewarding. There's not a feeling like taking off somebody's braces in dentistry. It's rare. Sometimes you just cry, just doing it and seeing their face. So the profession, I think, is going to grow in GP orthodontics, for sure, because there's more demand and fewer orthodontists. And, of course, I don't know how fast that's going to go, but I would guess it's going to grow quite quickly. And GP education is, I think we're well positioned where we are, and I don't see any other competition that even comes close to what we do. So I think that we're in a very, very good place for that. And the whole, as a whole, the orthodontics, it has to go to higher quality. The people are going to demand higher quality, higher quality, higher quality. They don't want the poor quality. And that has been a trend throughout the world, Asia included.
Yeah.
All of a sudden, things that were acceptable are no longer acceptable. They want it done right, they want it done well, and if you can't do it well, they're going to find a dentist that can't. So, as a young dentist, you're obligated to take the best course you can, learn to do it really well, learn to do everything really well that you offer, and that's going to be your key to success. And in orthodontics, I can tell you, if you do it well, you will have lots of patients that want you.
All right. Well, thank you so much. I think it's a pleasure having these discussions, and we appreciate it.
And Miles, I have to say, I'm proud of my son. He has taken this company where I left off, and I think it's way better now than what it was when I was here.